Comedy legend Harold Ramis died yesterday from autoimmune inflammatory vasculitis, a disease that causes swelling in the blood vessels. Ramis battled the disease for the past 4 years. But what is this deadly disease and what sort of treatment is available for it? Joining me now is Jason Wadler, President-elect of the Vasculitis Foundation, and Robert Lebovics, Side Director of the Department of ENT at the Mount Sinai Roosevelt Medical Center. Welcome you both to the program. Let me start with you, Doc. As I said in the intro, what is inflammatory vasculitis?
Well, vasculitis is really a group of diseases. And without getting too technical, it's essentially a dysregulation of the body's immune system that ultimately causes different sized blood vessels to be attacked and or inflamed. The next conclusion comes is what happens afterwards, and that is target vessels cause lack of blood flow, organs die. And
then, the question that everybody has is like, how do I get this? I mean, because, the news has been out and you say, yeah, it's a group of inflammatory diseases and it leads to this vascular inflammation and ultimately obstruction of the blood vessels. But people want to know, well, where does it come from? Does it happen just overnight, or is there a factor that triggers this inflammation?
Well, A, that's a great question. And B, you have to remember that this is a group of different diseases. Just like you're saying, what might cause cancer? Breast cancer is not the same as colon cancer, and I think it's the same here. In some of the vasculitides, some of the airway ones, like Churg-Strauss syndrome or Wegener's granulomatosis, there is some thought that it's something that's inhaled through the respiratory tract. In other types of vasculitides, it is known, for example, that certain types of infections, like hepatitis C, may cause certain types of vasculitis. But for the vast majority of these diseases, the answer is we just don't know.
Okay. So, Jason, tell us a little bit about your story.
Sure. Thanks for having me, Dr. Manny. And before I start, I just want to offer my condolences to the Ramis family for this just tragic loss. My story is that back in 2011, I was diagnosed with vasculitis, a severe form called, at that point, Wegener's. It's now called GPA. I had symptoms that seemed to be minor on their own, but in aggregate were creating major issues. I had trouble breathing. I had severe sinusitis in my nose and ears. I had issues with my skin, and I wasn't sure exactly what was going on. I was very sluggish. I was having a hard time staying awake during the day. And I went to see some local doctors who started to put the pieces together. And I was very lucky because, as Dr. Bob referenced, sometimes it's a very hard disease to diagnose because there are a variety of different symptoms that have to be evaluated and put together to identify this type of disease.
I was talking to the doc here and trying to get some of the factors that could influence inflammatory vasculitis. And, of course, we mentioned hepatitis and certain medications. Did you have any risk factors? Were you sick with any other medical condition, or were you on any kind of drugs that could elicit this autoimmune response?
It's a great question. I'm not sure that I was on any drugs that would have caused it, but I did have a history of autoimmune, but minor things like asthma, which once you have one autoimmune may start to open you up to have multiple autoimmunes. One of the things that is being looked at are environmental factors. I happen to live in an old home that we did a lot of rehab work to. Potentially that may have caused it.
Right.
So I think it's still unknown in terms of what may trigger the vasculitis, and it may not be the same for everyone, but those may have been some of the causes for me.
So, Doc, let me ask you a question now. I think I read that the combination of these autoimmune vasculitis disease may account for at least 200,000 cases annually a year, or something. I think that statistic is correct. Are we seeing more? And the reason that I ask you is the following. It seems that today in 2014, I hear of more pediatric allergies, food allergies, seasonal allergies. And when I talk to a lot of docs, they say, well, look, our immune system is not the same as it used to be, let's say, 50 years ago. It's a little run down, it's a little overworked, it doesn't react as well. So are we going to be seeing, because of the way society is, and Jason just mentioned, environmental factors, are we going to see more of this autoimmune vasculitis coming up?
Another great question. There are two components to an answer. The first is recognition of disease. In fact, one of the biggest problems I see as a clinician is that there's often a delay in diagnosis. Sometimes it's fatal, sometimes it causes a lot of morbidity. Fortunately now, the medical community is more aware of these groups of diseases, and they're making the diagnosis a little faster. There's certain serologic markers, at least in some of the diseases, the so-called ANCA test. I don't want to get into specifics
Yeah, let's
thereof.
not get too much in the clinical.
Yeah. But for practical purposes, there are ways of making these diagnoses more quickly and more accurately.
Right.
The other side of your question is something happening in our environment of the 20th and now 21st century where our exposure to our world, is it changing what's coming into our nose, into our mouth, into our lungs? And is our immune system evolving, much faster now than it has for the last several thousand years? That's a great question. I suspect yes, but I'm going to defer that to the real experts.
All right. Well, and those are, I think, the concerning factors. Jason, one of the things that you mentioned from the talking points that I got from you is that you think that early diagnosis can save lives. Were you early diagnosed, and how are you doing today?
I was early diagnosed. I was very lucky. I had what I call the dream team. I'm based in Chicago locally, that were able to pull things together. A crack pulmonologist and Dr. Friedman, a general practitioner, and my doctor here. I had a great rheumatologist as well. And so they were able to diagnose this quickly, but really it came down to me making the decision of, before I start to go on some pretty serious drugs, a mix of steroids and chemotherapy in the form of immunosuppressive drugs, that I needed to get a final diagnosis. And I went to Cleveland Clinic. I was lucky enough to get in there quickly, and they have some of the most skilled doctors in the world about vasculitis. Right. And they diagnosed me quickly and put me on the right path, and thankfully 2.5 years later, I'm living a relatively normal life, full work week, enjoying my family, and able to participate in the Vasculitis Foundation, which, just for a brief moment, they are the only international group supporting vasculitis education and research and awareness. So, for folks who feel like they may have these symptoms, I ask them to visit the Vasculitis Foundation, vasculitisfoundation.org, to learn more and learn more about other people's stories who are suffering from this disease.
All right. Well, thank you so much, Jason, and Doc. Thank you very much. Very important topic, very complex. I mean, and I encourage everybody to go to the website because, as I said, the symptoms are multiple. Early treatment can be the key, and again, you need to have an expert. And again, for more information, visit the website vasculitisfoundation.org. For FoxNews.com, I'm Dr. Manny.